All right. Welcome back to the How to Relieve podcast. I'm here with Bong Henry.
So great to be here. Thank you.
So great to have you on. We were just basically having a whole conversation that I wish I hit record for, but I'm excited for you to share all of your knowledge and wisdom on movement, pelvis, moms, all of it.
100% here for it.
Love it. Love it. Okay. So if you don't mind starting off telling us a little bit about you and your work.
Yes. So I am, my professional background is a pelvic floor physical therapist with a background in orthopedic sports. And I help the athletic pelvis with my specialty being in the perinatal period of life. And so people come to me in different points of their life. If they are menstruating, kind of trying to conceive, they usually find me if they're dealing with painful sex, um, or bladder urgency problems, like your bladder freaks out every time you like pull your car into your driveway. During the prenatal seasons of life, I'm usually working with women who are trying to work out smarter. There's a lot of misinformation out there about what to do, what not to do. So we're working together to make sure they're super confident in their workouts. They're having guidance on how to minimize their birth injury based on their unique physical needs, and then also how to optimize recovery so that they can get back to feeling like themselves postpartum. And then moms who are outside of the like birthing, postpartum phase, and they're maybe in their like carpool or acting like a Uber driver for their kids. That's like my current phase of life. We're working on similar pain issues, hip pain, I would say chronic pain. I see a lot of chronic pain, perimenopause symptoms, so like bladder leaks, and then low energy. So just being too exhausted to play with your kids on the weekend, too exhausted for sex. So working together so that they can show up as their best self and tackle their busy days.
So, when you are working with women across these stages, what would you say are some of the differences between someone who is, let's say, in their young adulthood? I'm an athlete. I like to run a lot. I like to lift and do yoga from time to time, to someone who is in their carpool phase.
Yeah. So the thing they have in common, they are both short on time.
Yes.
So yes, and I've thought about this, like for the people I've helped in like various points in my career, like there's very few people who just like have all the time in the world. And I think that's important to know because like if you don't make time for your health, it's not gonna automatically get there. One of the biggest difference is like my younger folks, usually they have like a performance goal. They're trying to be like better at like running fast and they have some chronic issues that are getting in the way. Um, and then the pain with sex may not show up on this, like the track, right? It might not show up when you're out on the trail. But it is something that is interfering with how they connect with the people who are their closest, or I guess the person they're closest to. And then the moms in the carpool phase of life, everybody's different, but quite often what I see is they're trying to do too many things for the time they have. And so one of the things we work on is kind of prioritizing using the time they have so that the things that are most important to them for their health get done. And then they are able to have more energy, have a pain free life, and keep up with all the demands of their schedule.
Okay. So, because you mentioned painless sex, what might be happening in the pelvic floor region muscularly when it comes to painless sex?
Yeah, so there can be a couple reasons why people have pain with sex. I think, first of all, talking about the pelvic floor, what is it? It's a collection of muscles that live in the pelvis. So we can't see them from the outside of our body, like you can see someone's butt, right? And yeah, with the pelvic floor, it has a few different jobs, and it's important to know it responds to the choices we make in our day to day. So, like, if we are stressed out, our pelvic floor will talk to us. If we're sad or depressed, it could show up. If we have a hormonal imbalance, it will respond to that. If we've had trauma, it will respond to that too. Or maybe we've had some sort of abdominal surgery or like back injury, a pelvic floor is not an island. So like it'll respond to those things as well. So with pain with sex, for some people, it might be from medical trauma or like not necessarily like sexual abuse in the childhood, but physical abuse or like living in a lot of uncertainty, anxious parents that they had, and that the habits that they had around potty training. For many of the adults I help, the habits they had growing up and the families they lived in and once they went off to college influence what their pelvic floor is doing as an adult. So that's one reason. For sometimes some people, it's a hormonal imbalance. So like my athletes who run a lot, they're not getting periods. That will cause hormonal imbalance. And for some people, that'll show up as bladder leaks and pain with sex and low libido. So
Interesting.
yeah, it just depends on the person. And that's where like understanding, like getting a practitioner who's gonna like really spend time with you and understand your history, what's important to you, what you're worried about, the current stresses in your life. Because all of that plays a role in like why your pelvic floor is back talking and also how to help yourself understand how to heal.
Love this because this is where our field and worlds collide. Because when you say that stress, whether that be from trauma in the past, recently, over exercising, just day to day life stress, why do you think the pelvis responds like so acutely? Because I think I do see this with certain people where it's like it'll be in my hip, it'll be in my pelvis, like the center of the body seems like that's the place where it starts to hold a lot of this tension.
Yeah, so everybody is a little different on like
Mhm.
how they're wired, but all humans, right? We have our automatic nervous system. So we have a way that we respond to what's happening in the world around us, and the pelvic floor is part of that. So some people like are more in tune with that for whatever reason. But a good example is like I'll ask like even in my like birth prep with people, I ask like, when you're stressed, how do you know you're stressed? They're like, "Oh, I might get sweaty or my heart starts beating." And if they've never learned about their pelvic floor, they may not mention that. And if we do a pelvic floor assessment and find a lot of tension and pain, now they have awareness that, "Oh, this is a part of my body that is automatically responding to the stress around me. I just didn't know it." But when we have that understanding of the like anatomical connection, so that like the pelvic floor, yes, we can like contract it and relax it like I can move my arm, but it also has those automatic firings that we like it's going to happen when whether we know it or not. Then we can actually help ourselves have some coping strategies to build resilience, specifically if we're like looking to like minimize how much injury that could happen in childbirth.
Sure. Yeah. Well, okay, because you and I were talking about how to even learn about the pelvic floor, because I mean, this isn't a topic that we get taught in school by any stretch of the imagination.
So
So then it feels like we're all in adulthood and we all have these muscles, and then we have no idea that what they are, what they do, and then we're experiencing these issues and we're just learning about them for the first time, and especially for women who are prepping for childbirth and the importance of this and or postpartum and all of this is like extremely important. So the Instagram version of this is see you see a reel, people are talking about the pelvic floor, and it seems like it's a really hot topic right now. I don't know in the past like 2 years if your algorithm feeds you anything about movement, it seems like this topic has been coming up more and more recently.
100%.
And
Yeah.
yeah, and it's been just like and it's just kind of these random clips. This is what you should be doing. This is how you should be doing it. And it's like I don't even know what I'm doing this for or how this is working, but this person is saying that I should be doing these Kegel exercises because I guess when the Paltrow was doing them, so I guess it's working. So
I know, right? It's just like things, a friend had a good post about like, don't buy things from the internet and like jade eggs and put them in your vagina just because a celebrity did it. But yeah, so it is, the expansion of social media has been really cool to improve awareness and like basic education. But there are pros and cons to that when people don't have access to like that personalized care, or maybe they're substituting it. Because there's a lot of great content, but it's not one size fits all. So, and there's also like an individual's interpretation of Kegels or not Kegels, right? Because that sometimes I'll have people, they'll come in and they'll be scared of doing pelvic floor exercises or a Kegel, which is a contraction, and then you need to relax. But they might be scared from an influencer who said never do Kegels, but maybe that's what they need in this moment when they're coming to see me, right? And then I also have you have some PTs who believe if you have pain, you should never do a Kegel. But at some point, you need to like develop resiliency, right? And have full range of flexibility for your pelvic floor. So recognizing that sometimes something that was good for us like 5 years ago may not be applicable now, just like our shoe size, like that changes as we grow, right?
Yeah.
But then also like generalized information may not be applicable to the situation that is in line with your past medical history, your past sports injury, your values, how your family raised you. It's not like a one size fits all. And this is where I'll say in birth prep, I'll see women at the end of their pregnancy who they were following a generalized program from an influencer, maybe skipping the things that they didn't understand. And that was actually probably things they should have gotten help for sooner, right? But then it's like, okay, we haven't done ab exercises because you were scared of them. So we're deconditioned and your abs working with your pelvic floor. And now your pelvic floor is really tight because you thought you were relaxing it, but you weren't, right? So then it's like, yes, work with a professional, but don't wait so long.
Sure. Sure.
Because we only have so much time if you're due in like a month, right? It's never too late in pregnancy, right? But I think we can also, when we recognize like the information on the internet is general, and if you're following someone who is not necessarily keeping up with evidence, then you can be going down a path that's not serving you. Yeah, because like Kegels, they're good for some people, they're not good for everybody. But there's a lot of people who will say no Kegels or do Kegels, right?
It becomes super camped. It feels like that it's this all or nothing, and especially when if someone is sort of going like, "You should fear this," then I'm sure that when they come to your office and they've been sort of taught to like, "Hey, this influencer that I follow all the time and it feels like we're friends," it
Yes.
then tells me not to do this, and I've been listening to that for a year, and then now here you are almost having to I'm imagining like, "Okay, I'm gonna put you at ease around why this could be helpful for you so that you can get the best help for your body." And so I'm imagining that it feels like for you, you're doing kind of maybe double the work on that.
Definitely. And I'll say definitely for abdominal exercises in pregnancy, because that, body image is a big thing for women. And like statistically, 70% of women will change their exercise routine early pregnancy to avoid diastasis. So they're worried about getting, like the street term is like ab separation, but the abs are just stretched. They're not really separated. So I try to actually use a like more corrected term instead of like just calling it ab separation, but that's what moms are fearful of. But so when you start changing your behaviors early on based on what you read on Google, then like your whole pregnancy, right? You miss an opportunity to stay strong. And I have a client who she was doing a very popular fitness program for her prenatal experience and seeing me. So I was telling her not to be scared and we were trying things, but she spent more time with that fitness program. So the messages of like, don't do this, don't do that, um, were bombarded to her more. So it was like, it took some time for her to realize, like, oh, like I'm getting this message 3 times a week. I'm seeing Dr. Bong like once every 2 weeks, right? So like the influences that were scaring her, and even like when she was no longer scared, it was still influencing her habit. It was really hard for her to break out of. So I love what you said about, yeah, we spend a lot of time with these influencers and they feel like they're friends. Right? They're very personable. Some of them have good stuff out there, but like,
Yeah, totally. I know. I'm like, yeah, aren't we all getting invited to Taylor and Travis's wedding? Because isn't she friends with everyone? Yeah, it does.
right,
It
right.
does have that feel to it. No, I can. So when you say, okay, at any point in pregnancy, someone can start doing the work. At what point might someone really want to like start to consider doing pelvic floor work?
Yeah. So what we do for addressing your pelvic floor at first trimester is different than like your last trimester. Also depending on who you were before you became pregnant. So if you were somebody who had a history of pain with sex, like that's the biggest one, right? And that was a chronic issue, or maybe you had medical trauma. Um, like a common issue is vaginismus, where like the pelvic floor like spasms and you can't have penetration. Those people definitely like first trimester in pregnancy, really unpacking the state of your pelvic floor if you weren't working with a pelvic floor PT before you got pregnant, right? Because sometimes people figure it out on their own. But like first trimester, unpack that because like your baby's gonna come through your vagina. If that's your goal, right? And
Yeah.
understanding how not to be fearful of birth. And then also being prepared for a C-section. Like everybody I help, I plan for education on C-section recovery and a vaginal birth recovery. Because yeah, C-section recoveries are usually emergency and not planned. And part of the trauma around that is because you didn't plan for it. And then it was like got dicey in labor. And so, there was like life or death for somebody sometimes. So yeah, but people who don't have a background of pain with sex or hip pain or any problem in their pelvis pain, first trimester, it's the education of what do you want your birth to be like? Start dreaming about that. It's never too early to like give yourself a positive narrative because quite often what we believe about birth is from someone else's horror story. And then for pelvic floor, it's understanding the basics of that it moves in multiple dimensions. It works with us. So you incorporate it into your workouts. And then so that's what it looks like for like if you're feeling good and you don't have problems, but you want to understand how to minimize your injury risk. Yeah, because it's a muscle, it responds to what's the rest of our body does. So you can train it. And we even have specific measurements that I can take to help predict the risk of how severe your injury could potentially be, depending on what's going on with your pelvic floor. So there's research on this. And you
Wow.
can't do this on Instagram, right?
Yeah, that you are really it sounds like a couple things. It sounds like one, it's very individualized because then
Mhm.
I'm imagining that these tests, you're then really creating a personalized program for each of your clients. And it sounds like that part of this is the almost giving people the education and the knowledge so that it helps feel at ease in a way. Like, because it sounds like during a stressful situation, the last thing you want to be is stress and in fight or flight because you don't know what you don't know. So it
Yes.
sounds like that part of your work and how you work with clients is I want to give you all of the information so that you're not caught off guard.
Yeah, and it's like I've pared it down over the years. So like the people who see me at like 36 weeks, like they get the labor prep boot camp.
Yes.
Because it's like at 36 weeks, like if I started with somebody in their first trimester, I want them to be like just relaxing at 36 weeks. 36 weeks, 37 weeks, your full term. So just giving what's appropriate for their knowledge gaps. But when people are filling out their paperwork, they have a choice of what they want to learn. So like early first trimester, like if you want to learn about mechanics, you want to learn holistic, you want to understand like being prepared for newborn care, caring for yourself with a newborn. Like you just plan the time around that so you're not cramming at the end. Um, and just kind of learning how to refine things and meeting people where they are over the years. It's been cool. For the people who want more, they can have more. And like you said, the being at an ease of what's happening, like takes some of the fear out of the situation. And right, so at the pelvic floor response to fear, you also have a little bit more easeful birth experience if you're not fearful about what's happening. And there's also great research showing like when women are prepared for their childbirth injuries, like understanding the different kinds that they have, they're less resentful, they're less depressed, they're less anxious, they have more pride, they feel more empowered. And like, who wouldn't want that starting your postpartum experience, right? But we're not really given that opportunity because our society is about like get your nursery together and like get ready to go back to work.
Yes, yes, it's more of a sprint than the marathon that it truly is.
Hmm.
Yeah. Okay, so if it's okay, I'm gonna throw out some like
Yeah.
almost case consults to you. Okay, so let's take someone. let's say they're in their early 30s. They're not thinking about like starting a family just yet, but they're the person who likes to run, maybe do yoga, lifting, kind of your generalized like, yeah, I like to move. Like I may not have a certain goal in mind, but I like to move. What might someone how might you start to work with someone in terms of, like, helping them grasp the understanding of their importance of the pelvic floor muscles and what this person could be doing to maybe help themselves and prevent injury?
Yeah. So in sports performance, the pelvic floor is the bottom of your core. So having a basic understanding of that helps as you're doing whatever else you're doing with running and weightlifting. So someone who's being like proactive about that, it might be as simple as like understanding how to integrate your pelvic floor in your weightlifting so you can hit a PR, right?
Mm.
So that you can run faster. I never met a runner who's never had an injury, but so
Yep.
that's like, that's a thing. Like if you have hip pain or you have knee pain, um, should we directly blame the pelvic floor? Not always, but it works with your core. Part of your pelvic floor connects onto your hip and it connects onto your tailbone, which is the bottom of your spine. So understanding how to help those different pieces like work together will also help your running be a little bit more easeful.
Yes. Yes, personally, runner, struggled with all types of injuries, hip, hamstring, the works, and it's been a journey. I kind of joke and say that I'm like, yeah, the amount of like money I spend going to physical therapy, I could repay for grad school going to physical therapy. Because if you like this sport, then that's kind of the expectation. Um,
Yeah.
so yeah, so it's so because the importance of the pelvis is stability, is what I'm hearing. Is
Mhm.
that this matters for all kinds of movement, walking, running, lifting, all of it.
Yes, yes. And then, someone in the 30s, maybe like childbearing is not their thing, right? That's perfectly fine. Um, but also understanding like our bodies as we age. So urinary incontinence is a leading reason why people will go to a nursing home. And it's not that they are leaking, it's that the leaking is not managed. And sometimes, like a common piece of leaking is urgency, right? So you may have the urge to go, and that's when you're leaking. You can handle it when you're 30, when you're 80 and waking up 4 times at night. That's not so cute, right? Because then you put yourself at risk for falling and breaking a hip. And so that's like the sequelae that would lead somebody to be admitted to a nursing home, like after a hip fracture or like those nighttime falls. Um, but if you were managing it, right? So say you understood this as you were aging, right? And then you're in your 80s, you're like, "Oh, I remember that PT said to like this is a thing." You get help sooner, right? And then maybe you kept strength training with your running, so you fell, but you didn't break a hip. You
Right.
you were able to get up, right? And then maybe you're waking up at once at night and not 4 times. So, just recognizing some of the things that are pretty common in our aging population don't have to be everybody's truth. So we do have some autonomy on just understanding our body parts. Like we go see a dentist twice a year, right? We go to a PCP, like the pelvic floor. It's another area that has had specialists that can help you have a good quality of life.
Yes. What is happening as we age? Is it that these muscles are atrophying, or is it that we lose the neural connection to them?
Yeah, so there's definitely in our 30s we start to lose muscle mass. And the pelvic floor is skeletal muscle. So that happens, I think, even I've heard some like of my mentors say that's like maybe the late 20s. But if we're thinking about it, right? If we're like looking at the childbearing population, like a lot of people have changes in their body before you think about having a baby, if you're having a baby in your late 30s, right? So
Mhm.
like stuff has already happened. So this is where like understanding how to like help yourself, and all humans need to be doing some form of activity that stimulates change. Because if you're doing something actively, like that counteracts some of that aging process. And then if you're born with a uterus and ovaries, you're going to go through menopause. And that's when your body's learning to live with significantly less estrogen. So puberty is when we're learning to live with more estrogen. So then it stabilizes, and then perimenopause leads up to when you're no longer having periods, and then you're menopausal. And so that muscle loss and bone loss is more rapid. So that's where, and then we have like changes in our collagen. So um, a way I describe it to my tween at age appropriate age is like, how do you know someone's old? For the most part, they've got wrinkles in their face, and like we get wrinkles in our vagina. So,
Oh, I
so
love that.
yeah. And then people who have work on their face is like their pelvic floors still get a little wrinkly too.
Yes.
But yeah, so then like having a pelvic floor that can respond well, like it can activate, it can relax, like it's got some hypertrophy, like that will be helpful when you are postmenopausal and things start to creep downward. Um, and so if you haven't had a childbirth, like that's a biggest risk factor for like some of the injuries that happen later in the postmenopausal year. But some sports or activities like in the military, female paratroopers, right? They have a risk of pelvic organ prolapse, the jumping out of the airplanes, right?
Sure.
So, and then, right, so you have that in your 20s. That's not everybody, but so that's an example of like you may not have children, but then that military career that may show up postmenopausal when you have less resilience.
Yes. So many factors that are happening and
Yeah.
going on. Yeah, no, and I love the prinkles on the face, prinkles in your vagina description. That's a good one. Um, so so it sounds like taking care of this soon and often and making this more of a habit and making it a lifestyle habit that because I think the other part too is that when I'm looking on Instagram or I'm getting more knowledge about some of these things, it feels like this is going to take me 2 hours a day to try and figure out the exercise on top of, let's say, working out. And then I'm also doing the corrective exercises. Like it feels like
Yeah.
that there's an and both to this. And trying to make it simple without feeling overwhelmed also feels like a challenge as someone who is just going like, I just want to be well when I'm 80. Where do I begin now?
Yeah. So how to like simplify it so that you're not overwhelmed?
Yes.
Yes. I love that question. So the biggest thing is understanding like what your body uniquely needs and what it needs for the current season. So if like you're in the season of like good health, it may just be like maintenance, right? You may not need to be like thinking about like doing a pelvic floor fitness program. You might have just like a wellness thing that you integrate with your yoga or after you're running or before you're running. Right? Because like running is a high maintenance sport in itself. So that's just like something to keep there. It doesn't have to be like hours. But if you are going through like an injury, you're pregnant, surgery, life is stressful and someone is more symptomatic, that's where we would pour into ourselves more so that you can feel good.
Sure.
And then
Yeah.
I like the way I work with people is they usually see me in a point of crisis, unless they're like trying to do like wellness. But some even my wellness people, I'm like, there's stuff to work on here.
You're in crisis. You just don't know it.
Yes, yeah, right. It's like the things below the tip of the iceberg, right?
Mhm.
So like the symptoms may not be at, like to the surface, but there's a lot of stuff brewing below. But yeah, when someone's in crisis mode and is reaching out, we calm things down, get you to a point where your symptoms are below the iceberg and get them as low as possible. And you're learning your self-care resiliency toolkit. You're learning the things that cause your flares. You're learning how to manage. You're reporting back to me. And then people see less of me as they're building resilience. And so then they reach a point of maintenance where things are integrated. But I'll say with the population I work with chronic problems, that we feel or see physically, there's a body habit around that. And it does take time for habits to change. And most humans, they'll have a flare when there's like life stressors.
Yeah.
So being able to like give yourself self-compassion when like you may fall off the wagon and you're feeling great, but then it's like, oh, your grandmother died, and then your partner lost the job, and then your dog like broke a leg, like everything happened at once, and now your butt hurts again. Okay. Well, go back to your resiliency toolkit and then, help yourself out until things calm. But I think people don't appreciate getting to crisis mode can happen. I feel like it happens quickly, but
Hmm.
it takes longer to actually calm. Like with stress, like stress is like a very like fast chemical reaction. Coming out of that time of stress, like you need to give yourself more time. But I don't think most people appreciate that. That it's like, oh, it takes time to recover. And if you did never had
Yeah.
recovery tools, it may take you a little bit more.
Right. So it is learning those recovery tools, and it like because it does sound like you're going. Do I do this top down or bottom up? No pun intended. Like, it's more like but it's more like, am I how am I doing with, like, my stress and what's going on in my life, and then how my body's responding to it, and then how do I bridge these 2 together? So it's like, what exercises am I doing for my mental health, but also what exercise am I doing for my pelvic floor and the center of my body to really physiologically de-stress?
100%. Yes. And so rarely do pelvic floor problems happen just at the pelvic floor, right? Because like humans, we're more than our pelvic floor. So like as a pelvic PT, people who I help, their recovery is as good as their ability to like do the work with their mental health therapist.
Sure.
And I help people who have some therapists who are like they just support them, and then other people who their therapist is like actively challenging them to grow. And so like everybody's speed is different based on the support they have, based on the time they're willing to invest, and based on how committed they are. So it's like that's where it's like it can't be a one size fits all, but there's so many pieces. And so pelvic floor is just a piece of the puzzle of the pain with sex. There's like so many other
Yes.
puzzle pieces that go into it. And that's what I think, back to Instagram, but Instagram misses is like as humans, we need that team. Like I can't effectively really help someone in chronic pain with trauma if they don't have a mental health therapist, if they're not willing to do something different with their nutrition, if they're not willing to like make time to sleep.
Right, right, yeah. And something we were talking about right before we started recording was the over-functioning mom who is probably new mom coming out of maybe having like anywhere from a newborn to let's say even like 1 year old. And it's there's bottles, there's feeding, there's up at night, there's all these things happening. And so when then we're talking about how do you de-stress, how do you take time for yourself? And they're going, what time? What do you mean? Bong, I have no time. And so how do you work with some of the moms who are really like feel like that they're in this acute phase chronically?
Yeah, and yeah, the new parent phase is so tough. So this is where if they're coming to me in that like new like I don't have time, but I want to do this, we like integrate their self-care within what they're doing with their kids. So maybe if they're breastfeeding or even bottle feeding, that's when they do their grounding, their breath work, they're not scrolling.
Yes.
Or we weren't really made to like be doing 6 things at once. If they're preparing to go back at work, do you have at least one pump time where you can like pump and not have to type and eat your lunch at the same time? Right? And then because that's a challenge for people where they're like, I have no time, so I'm eating my lunch and typing. I was like, well, what does 5 minutes with the computer closed? Or like on the outside of your office eating so you can actually chew, let your body digest. Like, so trying to work with like what feels like a very easy win
Mm.
for the habit they want to create. Um, And if the new mom is, like, used to, like, having 2 hours to herself to work out and you're on your maternity leave, what does doing your own tummy time exercise while your baby's doing your tummy time exercise, right? Because like, your baby you can't hold a plank for 30 seconds, your baby can't hold their head up for 30 seconds, so why don't you try a 5-second plank?
Yes.
And they're like, "Oh, I just sit there and stare at them." I was like, "I know, they're so cute, but, like, do a stretch." And then, seeing, like, who is on their support team, because sometimes it's an opportunity to, like, make new friends. Like, some people make friends at these childbirth classes. This is where it's like, "Hey, I'm lonely. Can anybody meet for a cup of coffee?" And then maybe we go for a walk together. I did that a lot in my first postpartum. We were living in Nashville. We moved there when I was 36 weeks pregnant. So my friends were from my breastfeeding group that I made postpartum. So we used to meet in the hospital, get help for our breastfeeding troubles, and we used to take a walk, long walk, while we were on maternity leave. And in that season, that first, we lived in Nashville 2 years. Like those are people I was pretty close to, but we met during a vulnerable time. So we like made community, moved our bodies. Community is good for your healing. Moving your body is good for your healing. So, you can combine those without having to create extra time in your day.
Yes. But no one does it alone, and this is a very vulnerable and what can feel like a very lonely time for a lot of new moms. So having that sense of community and support with other people who know what you're going through and
Mhm.
understand it can be immensely healing.
Yeah, and it's like countercultural to like American theology.
Mhm. Yeah.
Like this,
We're
like,
independent. You do it by yourself. Pick
yeah,
yourself by your
bootstrap it.
bootstraps. Yeah. Uh-huh. Yeah, it's great.
But yeah, it's like the rest of the world doesn't function that way healthfully.
Mhm.
And it's like for people who it works, but like it doesn't, yeah, it doesn't work for like a healthy human who wants to thrive. So I think that's also something what I do, like calling out some of the narratives that just slow people down from feeling their best. Cause like, yeah, it's not working for you, but it's a story, maybe the only story you've heard. So what are some other ways that you can create a different reality? That's not like fake, like you're delusional, but
Right, exactly. Yeah, yeah, to feel like that there's I think, again, to go back to their autonomy, like, you have a sense of agency in what's happening, and, when it feels like everything is chaotic, everything is up to this little human that so relies on me for everything. Everything is up to whatever whims that they have going on. Where is my sense of autonomy and agency in this? And it can feel like I'm just here to respond, to react to whatever's happening. That to actually carve out the time and say, "Hey, it's okay to take care of oneself," can almost feel counter to what the narrative has been.
oh yeah. Yeah, and that's the hard part too. Like and this is where like pregnancy is a beautiful opportunity, but like once you're pregnant, there's so many messages bombarded at you. But I think when people take the time to like kind of look at their values, and again, you can do this in any stage of life, but values, what are your purpose? Even before you get married, right? What are the goals you guys have in common? What are your mutual values? Then you're making decisions based on like what's authentic to you, and you can catch out the stuff that's going, like the mainstream stories that we're kind of like led to believe.
Absolutely. Yeah. Yeah, it's a signal versus noise. It's like, that can all be noise. What's my true signal?
Mhm.
Yeah, for sure. Okay, and we're jumping around a little bit, but here's another question. Are there any other symptoms that people might be having or experiencing outside of pain with sex that might indicate, hey, you need to see a pelvic floor specialist?
Yeah, so, would this be because I could, like, narrow down my answer, like, someone who's, like,
Mhm.
never had kids?
Like, can we do both? Can we do
Okay.
like someone who's never had kids and then someone who is in pregnancy or postpartum phases?
Mhm. Yeah, so, for people who are, like, born with a uterus, like, period pain, so period pain is not normal. So, understanding, like, if you've had period pain, that could mean there's, like, something biologically going on that you wanna see a specialized gynecologist. Pelvic floor muscles also can be responding to painful periods and whatever's happening in your organs just based on, like, some anatomical crosstalk. Um, Bladder issues, so, like, if you're having painful peeing, um, or you have bladder urgency, um, or, like, you can't even use a tampon, right? So, like, those are examples. I think that's, like, um, signs to see a specialist. Bowel problems, so constipation or painful poops. If someone is not identifying as female, they're born with testicles and a penis, pelvic pain usually shows up like, genital pain, so, like, pain at the tip of the penis, scrotal pain, butt pain, and then similar, like, constipation problems or, like, peeing problems. So any like pain presentation in the pelvis, or belly, like lower abdomen would be like a certainly you want to work with your medical team because there's a lot of other things that can be going on. But when you have a chronic medical problem, like you can develop pelvic floor issues secondary, and that also can be problematic.
Sure. Okay. So there's quite a few things that could be going on. I did not think about the period pain being a part of that prognosis.
Mhm. Yeah, the pelvic floor can, like, refer and, like, send pain signals to where our organs are. So, like, if you have a really tense pelvic floor, some people that is a factor to their period pain. Um, if you have a lot of tension in your belly muscles, that can contribute to your belly pain. For some people, like postpartum, if their periods change, it could be a combination they change to be more painful, right? It could be a combination of, like, a muscle imbalance, not everybody. So that's where just, like, understanding, like, your vagina, the pelvic floor muscles, they stretch up to 300%. So they go through an immense amount of stretch, in a vaginal childbirth. So, like, some that doesn't bounce back, right? And then sometimes people
Yeah.
will have a muscle that tears off the bone. Sometimes, the fascia and the connective tissue will get injured in the pelvis as baby's coming out. So that can also cause like heaviness and prolapse type of symptoms. Definitely seeing working with a pelvic PT can help you have a better quality of life.
Mhm.
And then leakage is a thing that people tend to blame for mom problems, but depending on the sport you play, it can happen without having a childbirth. So like the jumping sort of sports like running, soccer, trampolinist. I looked at these stats recently. So it's like trampolinist and gymnast is like 80 to 100%. Soccer is like 62% stress incontinence. Well, some of that plays a role with like the low estrogen. So if you're under fueling accidentally, but sometimes it's like the mechanics of how you land and your muscle imbalances, and lack of education, not knowing that there's muscles there that you can work on.
Yeah, I was just thinking that sometimes people would jump rope or like, yeah, I can't jump rope, even at a pretty young age, like early 20s. And so I was wondering, what is it about those kinds of sports that might lead to those symptoms for someone who, let's say, is on the younger end and in their prime when it comes to athleticism?
Yeah, so like jump roping, that one is I think 75% of like the competitive jump roping, and depending on what kind of jump, right? So like the landing will translate with some intra-abdominal pressure. So like pressure in your belly. Your pelvic floor needs to respond to that when you land. So in these jumping sports. So the more forceful you're landing, the more intra-abdominal pressure your pelvic floor has to control. Like so a triple under or double under, or like the tumbling from very high heights, right? Your pelvic floor would have to respond. If you're somebody who's like pelvic floor tension's riding high, you don't have good muscle excursion. You might be a lower tone pelvic floor, so you don't have good muscle control there. It could be like from your hips, could be the combination of the low estrogen, but it's usually like like the pressure management. In order not to leak, like you have to be able to keep the urethra closed when there's pressure from top. So,
Yeah.
and that's like a very complex mechanism that I had to water down.
That's no, I like learning about the complex mechanisms. Because like, okay, if we can nerd out on this real quick too, that what would you say about like some of the supporting muscles? I say supporting muscles, but like hamstrings, transverse abdominis, the things that connect to the pelvis. Where do they play a role in some of these symptoms, or even in pelvic floor PT?
Yeah, so they're all supporting, right? Because the pelvis is a small place. So kind of back to like we said, the pelvic floor is a piece of the puzzle. Someone who is like been scared to do abdominal work or maybe just like didn't think it was important, your rectus abdominis is like your longest muscle, right? So when people are scared to use it in pregnancy, it gets deconditioned. Compared to like if you were doing some crunches or sit ups, or depending what your ability was, like keeping up that muscle tone to help support management of that like pressure. Your hips, you have pelvic floor muscles that connect onto your femur, which is like the thigh bone. So having strong glutes really supports that fascia connection of the pelvic floor onto the thigh bone. Hamstrings are important for runners, but I think they're like the most underlooked, like runners don't think to like work on their hamstrings. They just do
Yeah.
squats.
Yeah.
So, but yeah, so and you need your hamstrings for like decelerating. So being able to control and running is like a series of single leg hops over time and distance, right? So that good, like that, how you control that landing if you have a lot of hip rotation inward and your knees are collapsing, from like weak hip mechanics, like that can also impact the forces that go up to your pelvic floor. If you have ankle problems and you're not landing efficiently, or if you have big toe, that's like big toe mobility is important for runners, right? So like
Mhm.
sometimes your pelvic floor is talking to you, but it's from a problem down below.
Which it's so interesting and fascinating to learn about because it's so intricate. It can also feel like where does it one even begin? Because like you're saying, like this pelvic problem could be from my ankle, from my big toe, from me not being able to connect to my hamstrings, or my rib flare that then is creating these like this extended pattern that I can't get out of.
Yeah, yeah, I know it can be overwhelming, the stories and the where to start. But yeah, this is where like having the outside professional help you is good. And then like all athletes who are like kind of happy and successful in their own definition of successful usually have a support team, right? So like you might have your acupuncturist, your massage therapist, your run coach, and then you have your PT. Like, so I'm sports pelvic, right? It's my like own little category. I help the athletic pelvis. Like before I was a did went into the pelvic training, I was helping like runners with knee pain, right? So I was helping people with back pain. Like that was my bread and butter. So like understanding how things work together, you cannot it's not always possible to find somebody who understands how things are. So then some people might need to see like a couple of different specialists. But I do have like sports PTs who we co-treat together. So they'll send me a patient with a pelvic problem that's not responding traditional sports PT. And then I'll like report back with what I found. And then we'll figure out how to like balance the schedule so the person's not like at 6 appointments at once.
Yes. Yeah. How did you get into this? What drew you to the pelvis?
Yeah. So I've been a PT 15 years. And after I had my daughter, I think I shared earlier before we were like recording, I had done half marathons. Well, so I didn't get much guidance after having birth for her. So I did a half marathon at 9 months postpartum, which is a perfectly fine time. I did the best I could with what I knew, but things that I did not factor into my training was like sleep regressions. So I was like, I was doing the bare minimum for training because I had done halves before, but yeah, like things about like sleep and my recovery. So I had pelvic pain. I felt like I was splitting in half, like when I got to the finish line. And I was like, well, that I didn't train for that. I had trained for rhabdomyolysis and like all sorts of other stuff. So then she was 9 months at that race. It was Nashville Country Music Marathon, I think, half marathon. So then as I was like recovering from that race, I had a colleague at the company I worked at who was a pelvic floor PT. And I wasn't at the time I got connected with that colleague, we had like a team meeting for something. I wasn't having the pelvic pain in the middle anymore, but I was having butt pain and tailbone pain. And she's like, oh, I can help you with that. Cause I had been seeing a sports PT at my company and it helped me get 75% better. So I went and saw Jenny, my colleague, and like we identified I had some tension in my pelvic floor. I got better quickly. And then I did my next half marathon a few months later, like nailed it. And then in that experience, I was like, surely there are more moms who want to be active like me. So I started doing the training. So that was about 10 years ago. And so I've had my private practice 5 years now. And then it's kind of really specific how people find me. So like I've just done more training to be able to better help people in pregnancy, and understanding the nuances of a pregnant pelvis. And I'm a birth educator as well, because just knowing the birth positions is not enough to like prevent trauma, right? Sometimes it's just like,
Right.
though your brain and your body don't read the textbook, or your baby doesn't read the textbook for birth. So understanding like the control thing, like where can you let go of control? Where can you prepare for things that don't go as planned? Where can you reduce your injury risk? For some people, the best decision they will make will be not to give birth in a hospital. Some people will not budget for that. So they have to be a little bit more strategic.
Right.
It's because,
Right.
like, I don't believe you should feel like you're preparing for war to give birth, but quite often when you're in a big institution and they have regulations, they are looking out for you. They want to protect you and your baby, but that may be different than what your goals and values are about birth. So it's like I'm coaching these people on where can you just be okay with the things you can't control, but control your controllables. You do your breath work, your pelvic floor work, you have a good team to support you for your recovery, and trust that there's no such thing as perfect.
Right. Right. And it's hard because it's when you're aiming to nail it and wanting to like no such thing as perfect. And then there's also the like, but I want it to go as best as I know I can do. I want to hit my own PR in this
Yes,
birth
yes.
experience. Okay. Like I want to hit that. So it can, yeah. So it sounds like that you take this from a very holistic lens through your own experience too. And it's going, yeah.
Yeah, definitely. And then so like I have 3 kids. My second postpartum, I was in the pelvic floor world, but I did too much on my own with my birth, and I trained my husband as my doula, which he loved, but it was stressful because I was telling him what to do in labor.
Oh my
So our
goodness.
third birth, third baby, I was like, okay, we are putting down the money for a doula. Like we need to do this. And it was good because like all births are different and it was a little stressful, but like I literally just squeezed my husband's hands, focused on my doula coaching me to breathe. And I do remember them telling me like to push in a way that did not make sense to me, but I just did it. And it's like, I think testimony to the whole thing, like your body doesn't read the textbook. Like sometimes you're going to improv. Sometimes things are not going to be as planned, but you can still do it.
Sure. Sure.
And my friends who are doulas say that happens a lot, so just kind of learning on helping moms be flexible about their birth plan. Like, yes, you can plan for that unmedicated birth if that's important to you, but you need to train for it. And then we push on your back in case that's the only thing available to you. And we also push on your hands and knees and like your side and like, so your brain has different ways to like reorient. So that way, but if one thing gets taken away from you, we don't want you to feel like you have nothing.
Sure. Yeah. Which it really is relinquishing that control and almost like, oh, almost going like, okay, I'm letting other people guide me through this, despite what I feel like, oh my gosh, what about this? And what about how I'm breathing? And what about this mechanical reference? It's what's happening in my body. And it's like having the faith in other people to lead through the process, which is challenging.
Yes. But yeah, even thinking about that for the hospital, like for my folks who are a little bit more on edge about their hospital birth, I was like, you have to trust your team. So, so it's just like, here are some questions you can ask them, so that way you could be prepared. Because I think even like with the pushing thing, like that's a big one from like, not just Instagram, but on the internet, people are like worried about pushing on their back, but it's like, well, what does the facility allow? So that way you get the reps practicing on your back you're going to be, if you're going to require you to move, right? Because sometimes you can labor anyway, but then the doctor knows best how to receive the baby in one position. So that when you have, like, I had a patient that happened to where her first birth, she didn't really have many choices. Her second birth, she came to me towards the end. And I was like, okay, we're going to practice in different positions. And the position that she wanted was literally taken away from her. They like moved her onto her back. But she was like, and that was like traumatizing in itself. But like, she was like, because we had practice on my back, it wasn't so horrible. But,
Mhm.
it's just like we can't control everything. We can't prepare for everything. But some things like you can ask questions and just recognize like where you do have to let go of control.
Right, right, and there's a rehearsal, it sounds like, for all of this. I can rehearse every position, and that way, I might be a little caught off guard, but I'm not gonna be, "I don't know what to do in this new position."
Yes, and that's where giving yourself that opportunity to just practice and improve your confidence. Because if you're confident, like, it doesn't matter necessarily what's happening. So a good example, I did my first Olympic weightlifting event less than a month ago, and you cannot show up to these, like, USAW events without a coach, right? So it was, like, official, I mean, I'm not going to Olympics or anything, but that's a sport. It's called Olympic weightlifting. So, but yeah, I got a coach ahead of time. A friend got me connected to this gym, so I showed up for practice. I had already had some background with, the Olympic weightlifting from CrossFit, but, like, working with a coach, we worked on refining my technique. I knew what I was good at, so going into the event, it was like, we're not trying to hit a PR, but you just were gonna have that experience, and it was really nice because the day of, when I was nervous, I just practiced what I had rehearsed previously. The coach is also there to help tell you where to be at what time because there's so many things going on, and you have to, like, wait your turn. It's like, a lot of moving pieces, and then when you're about to go on the platform, my coach, like, had me do some centering, and I was like, "Oh, I know how to do this." Right? And I
Nice.
also had a sports psychologist that I, had done some sessions with because I was like, "I signed up for this thing, but I'm nervous."
Yeah,
And
yeah,
so working with her also helped me understand how to, like, be present and have fun, and my goal was to be curious, and so how to stay focused on my curiosity, and so that event was, like, a really positive experience for me because my expectations were, for the first time, to have fun, and I had support. So, like, with birth, right? Like, practice your reps ahead of time, knowing that the training you've had in life has really helped lead you to here. Because oftentimes first-time parents are like, "Oh, I've never done this before." But you have overcome some obstacle, whether physical or mental, before that has given you some resiliency tools that you can use when things start to go not as planned.
right. I can practice the uncertainty of how life goes.
Yes, yes,
Yes.
yes. That because
Uh-huh.
that's life, right? Like,
Yeah.
that's a question I'll ask the couples in. I was like, when they come in, I was like, "Has your day gone exactly as planned?" If they come in the morning, they're like, "Sometimes yes." But I
Yeah.
was like, "Has your pregnancy, like the journey of conceiving, has that gone exactly as planned?" And quite often it's a no. So, and I do, like, have the partner come into a session if they can, so we can help them feel included, help them see how they can be supportive for postpartum, like, learn it in pregnancy.
Amazing. Oh my
And if they
gosh.
can't come, write down your questions or, like, show up on FaceTime. So
Yeah.
just we can make it work.
Wow. You are doing really great work here. You are doing what some might call the Lord's work.
I
So
know, well, it's like
yeah.
helping families, just like
Yeah.
that's the
It's
that's our future, right? If we don't have families,
right.
it's the future. So
Right, right. And I just I love that you're doing all of this in terms of how you're helping your clients and then really creating a truly holistic approach in how you support them with their family, with their other providers, with how they move, how they're breathing, how their pregnancy is going. Yeah, yeah. It just sounds like you're amazing. I mean, that's what I have to say.
it's a lot of fun. And I would
Yeah.
say, yeah, I started my business like 5 years ago. I was pregnant with my third in the pandemic. Many people were making life decisions then, and I was just like,
Mhm.
I couldn't. Well, before I was pregnant with my third, I was like, I can't see myself staying in this hospital system. But I was like, who does this in the pandemic, right? And then I got pregnant and had to make decisions about my position. So yeah, like Radiance has really evolved, but it's been cool to see how one of my goals was to fill in the gaps that I didn't see happening in the medical society. And our
Yes.
system is doing the best it can, but it's just like it can only do so much with the current, like, systemic constraints.
Yeah, absolutely. So, with this, where can people find you?
Yeah, so, I have an Instagram, so that's Bong Henry DPT. So, I like to just put out some information to inspire people, challenge the narratives that people might be, um, they don't know that they're following. If you want to work with me, and you're local to the area, radiancept.com is a great place to book in. And then I help people remotely. If you're out of the state, out of the state of North Carolina, we work together in like the health coaching realm. So like people who want guidance, on their pregnancy or postpartum fitness journey. Part of what I do is also help with my vast network connection. Like make sure you have a local practitioner, right? Because like I can't see your pelvic floor on Zoom. I'm not going to. But making sure you're just getting the right people on your team. But the health coaching is nice for like the foundations of health and making sure that you're living in alignment with your goals. And so that way life is like meaningful and purposeful to you.
That's great. Well, I appreciate all the work that you're doing and will absolutely be sending people your way. So,
Thank you. This was so much
yeah.
fun to chat. So
Yes, yes, seriously, you're welcome back anytime. And I feel like I said that to a lot of guests, but I feel like we could go on for hours. So this was
yeah,
a
so
lot of fun.
might need a part two.
Yes, yeah. I feel like I learned so much. I already feel smarter today. Well, thank you so much. And until next time, everyone, stay connected.